We are pleased to open this session, and I hope it will be okay, not too hot for you, and I will give the micro to my colleague, Yasser Khazal, to present our lecturer.
Thank you. So I would like to welcome SOPHIA ACHAB. I'm very happy to be here with Nadia Kadri on SOPHIA ACHAB to this session on gaming and gambling. SOPHIA has an extensive expertise in that field and contributed to many works and projects related to that. So SOPHIA, you are welcome. And
good afternoon. Assalamu alaikum. Bonjour. It's my great honor and pleasure to be here. Thank you to the organizers for the invitation. And I would like to share with you during my talk some information about gaming and gambling in high-risk populations. First of all, you may know that the field of addiction medicine has been deeply transformed recently by the introduction of addictive behaviors along with addictive disorders in a new category of the World Health Organization's gold standard classification ICD-11, which was released in 2022. And gaming disorder and gambling disorder has been formally introduced. Its rationale came from the clinical needs which were expressed during a decade by healthcare systems users, and its implication on clinical practice was to and is to enhance identification and treatment of affected individuals. Here you can find an article which you can read to learn more about all the rational and arguments and evidence-based arguments for which it has been introduced for a clinical and public health perspective. First, the first part of my talk would be on gambling disorder. And gambling disorder, based on the definition in ICD-11 by World Health Organization, its course is variable, and recovery is the common outcome, even if we don't intervene, especially for adolescents and young adults. However, for many patients, gambling disorder persists across the lifespan, and it follows a continuous or episodic pattern. Its intensity often fluctuates in relation to several factors, such as stress, depressive symptoms, and substance use. This disorder develops gradually over the course of years in terms of frequency of gambling and monetary value of wagers increases over time, and this is very problematic for individuals affected or at risk of gambling disorder. Its presentation, so typically gambling disorder has an onset in adolescence or young adulthood, so here we have subsamples at high risk. The early onset is associated with higher level of impulsivity, which is another individual risk factor. And the prevalence of this disorder among adolescents tends to be even higher than in adults. So really target this subpopulation in terms of prevention and brief interventions and early screening. Cultural-related features of this disorder. So its prevalence really varies in different sociocultural backgrounds. And for example, here you have in the definition by World Health Organization, which you will find online in ICD-11 draft, the prevalence, for example, in the US is lower among immigrants, whereas in indigenous populations, it appears to have higher prevalence in these subpopulations due to several factors. Some of them are greater financial hardship, which leads individuals to believe more that they can overcome their issues, financial issues, through gambling activity. Another factor is the location of casinos as well on tribal lands. So it is access to opportunities of gambling, which is easier for them. We have, in terms of variety, cross-cultural variety, we have the endorsement of specific symptoms which are different from some groups. Here you have an example with Asian Americans that can be less likely to describe that they are preoccupied with gambling, whereas Latinos and African Americans may be more likely to describe attempts to reduce and control their gambling. Risk factors in terms of sex and gender related features. So lifetime prevalence of gambling is higher among males. And the ratio men-women diagnosed with this disorder is 2:1. And it is wider in adolescents, so 4:1. And this may reflect as well the tendency to start gambling earlier in boys. The differences between the two genders, for men, for example, we have an earlier onset. And the course of this disorder is more protracted among them. They are more likely to recover even without intervention, and more likely to exhibit problems with comorbid disorders, substance abuse disorders, and externalizing behaviors. In women, the onset is later, but the symptoms, as in other addictive disorders, used to be to intensify more quickly. And they may come to seeking treatment in very, very severe presentations. They are more likely to seek treatment sooner than men, but they have different co-occurring psychiatric disorders, such as mood disorder, anxiety, and fear-related disorders. But for both genders, we have an issue as clinicians and as public health professionals, which is the low level of treatment seeking, which is across both gender less than 10%. A lot of work to do here. And here is a recent book that we released with a group of international female, which tried to compile knowledge about the gender perspective of addictive behaviors, gambling, and gaming, which you can read. It is released this year. Why people suffer from gambling disorder? What's the history behind? So in terms, for example, in psychological functioning, so there is a dysfunctional motivational process which is behind with powerful sensations which are sought by the individual, and as well, maladaptive coping plays a major role in the motivational processes. Addition to that, there are specific cognitive distortions under probabilistic conditions in those individuals, represented by illusion of control, by the chasing to recover the losses in previous gambling sessions, and the near misses, the failure of the learning process, the learning that you just memorizing that you have quasi-won when you have lost money. So these individuals have risky decision-making and insensitivity to feedback of their impulsive choices that they are making. And this is increased even when they are facing some cues of gambling, with high craving cues phenomenon appearing, which is highly at risk of gambling behavior and the relapse. The potent incentive nature of gambling, added to the physiologically arousing intensity, most of all with the online offer, which diversifies, which is accessible, which is very appealing to different subgroups of the population. And this can lead a minority of the gamblers to lose control and to engage in repeated problematic behavior. And they are driven by unsuccessful attempts to apply learning rules to a random activity. And again, addiction is a brain disease. Here's some evidence about additional risk factors, which is, for example, the kind of attachment. And we have evidence that fearful and preoccupied attachment patterns were shown to be associated, positively associated to problem gambling. And they were mediated by additional factors such as alexithymia, dissociation, and impulsivity. Therefore, cognitive remediation interventions are key for gambling disorder, and here you can find a systematic review on what exists. Another important thing is the increasing the access rate, the access to people, the coverage, treatment coverage of people suffering from gambling disorder. And e-health is showing more and more efficacy and evidence in dealing with problem gambling reduction in terms of money and in terms of frequency. And here you can find an article that we wrote with some colleagues from Zurich and from Lausanne, Yasser Kazal, for example. The other part of my talk is about gaming disorder, the other one, the more recent one, for which new care needs started to happen mid-2000. And health systems were progressively overwhelmed by the treatment demands for something which was not known before. They have been challenged by the demands coming from the individuals themselves, but more frequently by referrals by relatives, care professionals, or social workers. But the response has been heterogeneous because there were no blueprint for it, no landmarks. And the growing evidence on the harms to health of the individuals who were using the internet for different purposes, including for gaming, in a problematic way, led World Health Organization to take actions and to set an expert group which was meeting annually and helping advance the field, which ended, I'm happy to that, of the inclusion of the disorder within addictive behavior, new category, and addictive disorders, bigger category. One of the papers that we've wrote and released with other colleagues from the group is this one that you can read, which states what are the arguments, the clinical ones, the public health ones, that should lead and have led to the introduction and recognition of the gaming disorder. Still, delineating boundaries with different things, the normal gaming behavior, other conditions, what number of hours, for example, what sets the threshold for diagnosing the disorder, was very hard to make because there were no substance, there were no doses. It's a behavior. And here you can find two additional papers that you can read, which are about the delineation of gaming disorder for diagnosis, management, and prevention, and another one which states that one important condition to consider gaming disorder is the functional impairment. Basically, the core issue is not how many hours. It's at the expense of what, in terms of functioning, important for the individual within his or her system. So how much is too much? Different dimensions should be considered. The exposure to gaming, of course, duration, frequency, intensity, of course, it plays a role. Driving forces behind the problematic behavior, and two of them, for example, have shown after research that they are coping, and the motive to game, which is escapism. Escapism is basically gaming to not be aware of what's going on in your life in negative, escaping from the experience. And lastly, the negative consequences. What gaming disorder is? It is defined by World Health Organization and ICD-11 as as having necessarily three factors: impaired control over the behavior, increased priority given to gaming, and continuation or escalation despite the occurrence of negative consequences. It should be of sufficient severity to impair the functioning of the individual in important areas of it. Can be continuous and can be episodic or recurrent. Some kind of games can lead to gaming disorder even if the individual doesn't play each day. And the period considered to diagnose is 12 months. Can be shorter if it is of much severity. Again, in the ICD-11, the boundary with normality says that we should not diagnose, in absence of other characteristic features, we should not diagnose gaming disorder only when we have repeated or persistent gaming activity, or when we have only daily gaming activity, or when the individual is referred only for gaming for changing mood or alleviating boredom, or facilitated some social interaction. Should not diagnose gaming disorder only for that. We should as well consider that some specific age group and social groups are different from the adults, for example, in terms of digital generation and cultural engagement with peers behind. Again, sex and gender-related features for gaming disorder. Unsurprisingly, we have males more frequently affected by this disorder, mainly, but equally in adolescence and adulthood. Please consider, even if it is not an adolescent or children, can suffer from gaming disorder. Girls are as well affected by this disorder, and the diagnostic requirements may be at greater risk of developing emotional or behavioral problems. Here you have a chapter that I wrote in this book that I have introduced on what we do in Switzerland, for example, to deal with this issue from a gender perspective, be it for patient, be it for women relatives, or be it for from the perspective of the healthcare professionals, the female ones. Boundaries with other disorders, very important to consider. When we have coping, for example, as one of the factors that can lead to gaming disorder, how you make the difference between, for example, mood disorder or anxiety disorder and gaming disorder. Should you diagnose both at the same time and treat in terms of dual diagnosis or dual disorders or not? Boundaries should be made first with hazardous gaming, which is a novelty as well in ICD-11, which states that it is a pattern of gaming which is appreciably at increased risk of harmful physical or mental health consequences, and this state may require some interventions or monitoring for those individuals. Consider hazardous gaming. Another boundary, very important to make but very hard to make, with the developing changing offer, which are blurring the boundaries between gaming and gambling. But it should be made if the gaming behavior occurs and focuses on waggers mainly. Gambling disorder is more proper as a diagnosis than gaming disorder. Bipolar disorder, for example, you may have referrals from other health systems or health services for this. And you can make the diagnostic when the gaming problematic behavior occurs outside mood disorders as well, mood episodes. But it can be comorbid, co-occurring. Obsessive compulsive disorders, how to set the limit and the difference between the two. Gaming disorder, at the very beginning, you had pleasure, dopamine release, intense dopamine release related to gaming experience, which in obsessive compulsive disorders, traditionally it is intrusive, unwanted, and anxiety-provoking obsessions. Boundary with disorders due to substance use, even if we know that they are highly comorbid, but the co-occurrence of intoxication should be put aside if it occurs with gaming disorder, and further assessment should be made. Boundary with the effects of psychoactive substances, including medications, and this disorder should not be diagnosed in such cases. Here you can find some readings and some papers that we've published, which are about, addiction is 3 necessary determinants. There are a lot of them, but the co-occurrence of vulnerable individuals in an environment, specific environment, that is encountering an addictive product. And in terms of individual vulnerability, we've made some research to identify low self-esteem, for example, high impulsivity rates, some specific motives of gaming which are related to problematic engagement, such as escapism. And please do think about gaming disorder even in seniors. We've conducted a survey and we did compare in Switzerland and Poland in individuals above 65 years old, and we found the second component important, addictive product. What is addictive in gaming? So the mechanistic basically is rewarding in a very specific pattern, progression, immediateness, and touching, rewarding different type of individuals. Here you can find as well an article which as well treats the issue of all the challenges that the inclusion of gaming disorder has faced the last decade, which is the pressure from the gaming industry and all the developing gaming offer, which makes a lot of money. In terms of environment, wanted to show you just one, maybe something that can resonate with a lot of you, which is COVID-19 pandemic and the social measures that prevented people from going outside, from having other alternatives, with increased anxiety and preoccupation about their loved ones. So it has been a specific environmental triggering factor for individuals at risk for gaming disorder. And this article was about 4 centers worldwide that just shared what they have experienced during this period. So basically, the gaming time among the problem gamers, evidence has shown that it had increased during this period by 25% during the pandemic. And the adolescent problematic gamers reported a threshold increasing in gaming time. And the symptoms of gaming disorder as well increased among adolescents more precisely, more majority. And as well, another factor, which is gambling inside gaming offer, which is loot boxes. And the loot boxes spending was significantly associated with problem gambling symptomatology during lockdowns in gamers. So this data suggests basically that lifestyle changes arising in pandemic condition, including introduction of public health measures, may be associated with greater risk of excessive gaming for the vulnerable gamers. In terms of treatment, what has changed is, first of all, levels of distress and impairment in individuals suffering from gaming disorder increased during this period. Second, there was a consistent client demand during this pandemic, and it has increased during it. Third, the access to specialized services adversely affected during the period because there were other priorities, of course, somatic priorities. And it was very difficult for individuals affected to obtain the initial appointment, but as well to maintain their service engagement. And fourth, the provision of online treatment helped, and it worked. It has developed a lot during this period, which is a positive thing as well, in contrast. And they were used by the patient in addition to face-to-face treatment. All these achievements, milestones have been done and achieved, and I'm very honored to have been part of several of them with a lot of very amazing people. Some of them are here in this room. And it has helped to draw what were the past and future challenges for health. Here you have an abstract published in GBA on it. And in terms of treatment response, it is helping. Having a gold standard helps. And in Switzerland, I have the honor to run the pioneering specialized facility, outpatient facility on addictive behaviors. And we have went through a quality approach towards increasing access, facilitating identification and standardizing it, and managing the most evidence-based way the clinical presentation of people that we treat. Facilitating access as well, building upon internet, even if it can provide a disorder, but it can provide treatment and access as well. They can self-test, for example, before having the first appointment, and the first appointment occurs very fast, less than 2 weeks, 10 days. In terms of gender equity in treatment delivery, we are very focused as well to comply with the needs of both genders in our facility. One of the colleagues in the previous talk on dual disorders, she spoke about landmarks for practitioners in clinical practice. So here you can find as well the Courrier des Addictions in French, some landmarks for practitioners. And the other one is just helping to have more landmarks in terms of the question that we do have very frequently from patients, relatives, media: how much is too much? And this is a study that we've conducted with Daphne Bavelier and her team and Michael Rich in Harvard on League of Legends, which is a MOBA. Clinical landmarks for practice from experts as well. You have a paper on what the experts in the area, working since decades in the area, they think about how to assess and how to diagnose this disorder. Standardizing the assessment in Reconnect, the facility I'm running, I've started in 2014 with the nurse that I've had at the time, and I just updated it in 2020, adding neuropsychological processes underlying the gaming disorder. It's very key, it's very important, and you have these algorithms that helps to navigate within the health system. Personalized psychotherapy is very important, and this is how we work. We work trying to assess the psychological function of the behavior. What is behind coping mechanism, escapism, difficulties in life events, etc., etc. Future perspectives. Health promotion is key because gaming is everywhere. Internet is everywhere. It's in your pocket. So education is key, and health promotion about the proper media use is very, very important, not to be at risk, not to develop the gaming disorder if you are at risk. And here are some media articles for public audience to increase awareness and to answer the concerns. And what we are doing under the auspices of World Health Organization basically is to follow with after having ICD-11 diagnostic criteria, to develop comprehensive cross-cultural and informed assessment for gaming disorder. Further, and for now and for the future, the great challenge will be building capacity and training professionals to manage, to assess, to work with the adolescents, adults, both the genders, parents, relatives. And here is an example. I'm part of the cyber addiction experts in Swiss Federal Office of Public Health, and we developed this tool for professionals, healthcare professionals. It is available in 2 languages, in German and in French, which is a guide for professionals to dive in counseling parents for the proper media use of their children. This is a really great challenge, because at risk in our current society, digital society, is very hard, because, as I said, internet is everywhere, is more immersive. Internet is not the issue, it's the usage made of it, and specific online activities which could be addictive and other not. Thank you very much for your attention.
Thank you very much, Sophia. I forget to say that you are also with a Moroccan background, so you know also the specific culture on that you work in Switzerland, in Geneva. Thank you very much for your talk. So we have time now for the question. We are sharing this discussion with Nadia Kadri.
Do you have any question? In Arabic, French, or English, or Spanish as well?
Also Spanish, yeah. And a bit of German. I have one question, Sophia. You worked, so you have this emerging issue related to gaming, and gaming is very common among young parents. Are very stressful about the gaming of their children, and you worked on a group related to what are the common advice you can give to the parents. So what emerged from this work?
Yes, in our working group for the Office of Public Health Swiss one, what emerged is what is helpful is to have, for example, the really fostering the communication within the family about the media use, and including for gaming, not to end in problematic pattern of use. The other one is as well in increasing knowledge of parents about digital activities and what's going on, and what are the cultural factors that are very important, even if it is a screen with headsets and you have no access to your kid. There are a lot of social interactions and emotional engagement in there that maybe could be helpful for you to know more about it, not to consider it as the issue, but as well as maybe helpful to engage in non-problematic gaming behavior, for example. And the main threshold really to consider is not number of hours. It should, of course, respect sleeping hours, respect the food intake and the quality of the food that is taken, the physical activity as well, the stretching and having physical activity for good health. And the other thing is the functional impairment. Really retain that. Take home message. If one individual used to be in some way and changed dramatically, negatively of course, and isolated, focused more and more with a lot of negative consequences. Here you can say, maybe it's gaming disorder.
On a une question, merci Sophia. On a une question devant, juste là. You have to, right.
So I have a question. Thank you. You mentioned about the boundary between gambling and gaming, or rather the fine line sometimes between gambling disorder and gaming disorder. Usually in medicine it's crucial to get a diagnosis right, because together with the clinical picture it tends to guide you towards a management plan. In this case, gambling and gaming, how much would the management actually vary, and So how important is it to get the right diagnosis?
If you have both at the same time, so you have the two conduct, the two patterns of behavior, and you consider, according to what I've said, to what WHO says in ICD-11, that gambling disorder is the first, and maybe a gaming component as in there. So treatment should be integrative. You should treat as if it was gambling disorder, but taking into account as well gaming mechanistic social interactions within gaming activity and what kind of games, what are the issues, the financial issues within game. Thank you. Yes,
now
it's
it
working.
is. Thank you very much for a very comprehensive and very intelligible presentation. In the United States today, we are finally connecting the dots very importantly between opioid use disorder and corporate marketing, with the Purdue Pharmaceutical Company being the poster child for misbehavior and liability. Given what has gone on with now the ICD-11 and the work that you have done on diagnostic criteria and all of that, in terms of interaction with the corporate marketers of the gaming and gambling systems?
So there are a lot of different experiences in different jurisdictions in the world. For example, for gambling companies, in some jurisdiction you have a responsible gambling, which is a label that they have. Can be greenwashing, can be social responsibility, just kind of marketing, but can be as well a good way of doing prevention and of referring the patient. And even if for them, for gambling industry, it is helpful for them to have just where to send the person that has lost a lot of money, which is maybe suicidal and having no more money to spend, but a lot to say in the gambling facility. Gaming industry, yes, there are a lot of pressure, of course, because there is a lot of money behind, and there is esports, which is less sports than with a lot of lobbies and a lot of pressure, of course. But at the same time, I have a lot of colleagues, for example, engaging with gaming industry to advance the knowledge and to have data coming from the gaming platforms, to have not the reported by patient, but what's going on really on the ecologically within the games, to have better data and engage in partnerships, for example, without conflict of interest. It's very difficult and very hard to make, but yes, ideally we should.
Merci pour l'exposé qui est très intéressant. Pour les jeux pathologiques avec les comorbidités psychiatriques, surtout que les jeux sont plus fréquents, surtout si les bipolaires, les maniaques. Deuxième question, quelles sont les mesures pour minimiser les jeux d'argent? Par exemple, on a entendu parler d'interdire les cartes de crédit. Merci.
Merci beaucoup pour vos deux questions. La toute première, en fait, c'est...
You may summarize, Sophia. Sorry, Sophia, to interrupt you. It's okay if Sophia answer in English.
Can I answer in English?
So, Sophia, you can summarize the question and answer.
Yes, so the question basically was what's going on to how to make diagnosis, for example, for gaming or gambling disorder when you have manic episodes. Basically, if the behavior, the disorder persists outside the manic episodes, for example, it goes in the direction that it is gaming disorder. Even if you can have co-occurrence, you can have manic episodes within bipolar disorder and a comorbidity, which is gaming disorder, okay? And how to, the second one was how have a memory issue. How to deal with the financial harms of gambling, and what do we do? What are the tips, the treatment tips that we can give to patients? And effective, indeed, when you have digital payment, it's a much higher risk for people. So avoid that. Avoid having a great amount of money with you. Be very careful, for example, when your salary, you have a period, a certain day in the month, for example, or a week when you have your salary, be careful and put some controllers, external controllers. The help of the family can be key as well. And in some jurisdictions, for example, in Switzerland, we have the possibility to, the opportunity to self, how to say, ask for being forbidden from gambling in certain places, for example, in casinos, and it can help you, for example, and you can make as well the same thing on some online platform, but the official ones. In Switzerland, some years ago, we've opened the online gambling offer, but it is under control by government and with some conditions such as responsible gambling and the capacity to offer the possibility for individuals to disengage from your platform as well.
Thank you very much, Sophia, for that excellent presentation. You hadn't mentioned much about the use of medications in the treatment. Could you just elaborate on that a bit? Any research regarding medications for the treatment of those disorders?
What has been conducted is different kind of trials. For example, some trials were on the treatment of comorbid disorders, for example, anxiety and depression, and using the medications from those, treating those disorders with certain efficacy, but not completely over the whole disorder. The second track that has been followed in clinical trials regarding medication was to use those medications that were coming from the addiction field, and trying to see if they were really efficient in dealing in resolving the problem. But at the time being, there is no evidence for first-line treatment and efficacy of specific medications for these disorders. Maybe Marc can tell much more later. No, if you want, it's not that way.
We have one question. On a une question sur la gauche au milieu. Can you
Just raise your hand.
Merci beaucoup. Je voudrais remercier la présentatrice pour sa belle présentation. Moi, ça m'a beaucoup intéressé. Mais j'aimerais beaucoup qu'on mette l'accent sur la prévention et la sensibilisation. Parce que moi je viens de Dakar, hein, je suis psychiatre, addictologue, je m'occupe du centre d'addictologie. Et cette année, nous avons mené une étude sur les jeux d'argent et de hasard au niveau de la loterie nationale, mais qui avait montré quand même que c'est un problème qui prend de plus en plus de l'ampleur. Parce que nous avons enquêté des joueurs qu'on a trouvés dans les salles au niveau des 14 régions du Sénégal, et on avait trouvé que 95% présentaient des risques liés au jeu, surtout de la dépression. Et c'est quelque chose qui n'est pas encore bien pris en compte, n'est pas encore connu, c'est un phénomène insidieux qui prend de plus en plus de l'ampleur, et je pense que la meilleure des choses, c'est vraiment de mettre l'accent sur la prévention. Et ma question, si on doit faire de la prévention, sur quel axe on devrait mettre l'accent? Peut-être vous avez une expérience par rapport à ça, si vous pouvez partager avec nous. Merci beaucoup.
Thank you, je vous en prie. Thank you for your question from Senegal, which is an African country dealing, as you said, with increasing demands and the issues with gambling. Your question was about prevention is key for this kind of disorders, and what would work as a prevention strategy. So what works, it's the what you have when you can, for example, whatever reduces the access to, whatever makes it difficult that the individual at risk encounters the addictive product in kind of environment. So what should be handled is the access for children, for example, work on it, yes. It should not be accessible for children and for minors. The second thing is education, since the very beginning, to educate people on the harms of gambling. Third thing is, if it is culturally, for example, in some jurisdiction and some regions in the world, culturally it is within the way of living, and it is facilitated by some periodic tombolas and lotto tickets and this kind of organizations, and be careful of at the same time having some prevention messages and some health promotion, yes, in campaigns.
Thank you for your presentation. I'm Nicholas Verhovsky from Riga Psychiatry and Narcology Clinic from Latvia. And I have a question about if we talk about gambling and this diagnosis, is it possible to put this diagnosis for children? And when we talk about gambling, there is money or sport activities and totalizators, there is money, money, money. And children often do not have their own money. And it's the criteria some, and also we give in schools opportunity to start study computer science, everything. And when, for example, too long time spent by computer, by programming, becomes addiction, or it is addiction because it stimulates by system. You can be paid when you are aged 14, working in programming, IT spheres. Where is this border? Where we start to talk about addiction?
So the first part of your question is about the financial harms for minors and children and the access to gambling offer. If you think that children don't have their own money, they do have their own money. They have money of others. They can send someone to buy, even if you set the limits. And another thing which is of high risk, and it is developing hopelessly, which is the skins. Skins are kind of items, in-game items that they buy, but they don't buy it with concrete money. They buy it with within the integrated buys with their parents' credit card, for example. And this is a disaster. This is a new seeking treatment motives last years, for example, when the parents discovered that they have lost amounts of money that have been used from their credit card for gaming items buying. Educating, yes, educating about the gaming, the risks and the positive things, because there are, in most cases, it's positive to engage in a lot of digital activities. Being IT or being passionate by informatics, it's not a condition, risk factor necessarily identified at the time being. There is a over-pathologization to avoid regarding using media, using informatics, using computer is not the risk factor. It's the pattern of use, because you have individual factors, risk factors. There is an environment and there is a specific offer that you are very sensitive to be rewarded by.
Okay, I think we are reached our time, and very big thank you for your presentation, for this topic, which is very interesting, and many things are coming. And thank you for the audience and your participations.
Thank you.
Thank you.